here, Dr. Pratik Nishant, and I think he's from the first batch of AIIMS Rishikesh, while done his MS from US.
Thank you, sir. Good morning, esteemed panel. Correlation of MIBO skills, symptom score, and science score for MGD in Indian eyes. I have no financial interests. MGD is characterized by terminal duct obstruction and changes in glandular secretion. It is the most common association of dry eye disease, and there are known risk factors for MGD. There are many grading scales which are available for MGD, but they are very cumbersome. In addition, there is significant inter-observer variability. The OSDI, the symptoms is the symptom score, the 6 MGD sign scores, and the improved MIBO scales are means for assessment of the meibomian gland disease. But non-availability of validated MGD grading scales suited for the Indian outpatient setting is a gap in the present knowledge. Although the three systems can help in grading of MGD, extensive literature review did not reveal whether a correlation exists between them. So the evaluation of the correlation will analyze whether the improved MIBO scale used alone can determine the severity of MGD, or a combination of grading systems is actually needed. To the best of our knowledge, there is no study to correlate the meibomian gland loss as per the improved MIBO scale with existing symptom and sign scores in the Indian settings. So this was the hospital-based cross-sectional study from October 19 to May 20. It was approved by ethics committee, and primary MGD subjects were included. All participants filled the OSDI form, underwent complete ocular examination and eyelid margin examination, and the MGD sign score was calculated using the sum of 6 grading systems. Infrared imaging of the upper and lower eyelids was done using a specular microscope, and the areas of meibomian gland loss were visually assessed, and the score was assigned based on the improved MIBO scale photographic card. So the OSDI was calculated as per standard formula. The 6 grades were assigned as per the grading which is as shown and which is standard. And the MGL score was assigned by comparison of the MGL areas with the figure on your right, which is the improved MIBO scale. On the left, you can see the specular microscopic findings, which clearly demonstrates all the areas of meibomian gland loss. And in the center, you have the slit lamp examination of the upper lids and the lower lids of the patients of meibomian gland disease. So based on the findings from a pilot study, the sample size of 124 eyes was calculated, and appropriate statistical tests were used, and scatter diagrams were used to visualize the findings. Spearman's correlation coefficient was used to determine the correlation, and a coefficient of greater than 0.5 was considered clinically significant. The JT test was applied to evaluate the distribution of varying ordinal scores, and the R effect of the JT test was used to calculate the effect size. So 68 subjects were included, and 212 eyelids were included. The OSDI ranged from 6 to 90, and the sign scores from 0 to 15. The MIBO scale scores ranged from 0 to 4. There were 29 males and 24 females. The distribution of OSDI as per the sign score and the MGL score, which is the MIBO scale score, is as shown. These were not clinically significant, but the comparison of MGL score with MGD sign score showed strong correlation, which was statistically significant, with a correlation coefficient of 0.83, which is again clinically significant as well. So the JT test applied for the correlation between the meibomian gland disease sign score and the meibomian gland loss that is evaluated on the MIBO scale showed a very statistically significant JT statistic, and a very large effect size that is evaluated from the JT test. So this study evaluated the validated symptom score, the sign score, and the improved MIBO scale. And there are very few comparable studies which are conducted in the past which have evaluated the clinical utility of photographically aided scales, such as this scale, in comparison with existing symptom scores or sign scores. Excuse me. Arita et al. Have assigned scores to the 6 parameters, the sum of which forms the existing basis of diagnosis and the assessment of severity of meibomian and gland disease, and it requires both slit lamp biomicroscopy and meibography. And in that article, they have provided the representative images for the grading of MGD. Though useful, it is time-consuming and cumbersome in the clinical setting. The visual scale, known as MIBO scale, comprises of a picture card and allows the observer to assign a score depending upon the image to which his condition corresponds. Linear regression analysis is well correlated with the OSDI score, which is calculated by Pult et al. However, this is not possible in the clinical setting. Wang et al. Have used the sum of scores of both eyelids, but correlated this with the speed questionnaire. Computer software can be used to analyze the areas of meibomian gland loss, which is available in commercial meibomian gland analyzers, but again, this is very cumbersome and costly. Robin et al. Have evaluated that the OSDI and the mean NGL score are well correlated in subjects that are, that are presenting with Meibomian gland disease, but they did not correlate the two parameters among these patients. And Brooks and Gupta have shown that the Meibomian scale score in refractive surgery patients. So now, Meibomian scale alone can be used for reliable assessment and grading, but we still recommend independent symptom assessment. Thank you. Original work, sir. Original work from AIIMS Rishikesh in UK SOS. There you have it. Thank you, sir.